Hi, my name is Ken Miller. I'm a psychologist and a researcher at Holland, based in the Netherlands. I want to share a few thoughts on supporting refugee families during the COVID-19 pandemic. So it's a time of vulnerability and fear generally, globally, but this is especially so for vulnerable communities who are already dealing with poverty and overcrowding and a lack of medical care before the pandemic, and then this hit. And this heightened vulnerability and heightened fear is really the experience of refugee communities around the globe right now. Now, there's been a lot of awareness campaigns for the general public that are aimed at generating awareness of the dangers of the coronavirus and how it spreads, and then actions that we can take to stop the spread and to keep ourselves uh, safe, or at least lower the risk of getting sick. But for refugee families living in the impoverished conditions of camps and settlements, well, generating awareness isn't hard, but taking some of those preventive measures can be pretty tough. So, for example, hand washing with soap and water is one of the best things we can do to not get sick. But what do you do when you don't have regular access to water or soap? Um, Social or physical distancing, uh, it's enormously helpful. It's critical to stopping the spread of the virus. But how do you enact that? How do you do that in settings where overcrowding is a really big problem, where people have to stand in crowded lines to get food or water or other support, or where there's simply not room in the refugee camp to create that kind of space? So when we raise awareness about the dangers of the virus and then offer methods, suggest methods for staying safe that are very hard to enact, we can actually increase people's sense of fear and vulnerability. So it's really important that we address these barriers to staying safe among refugees so that we're not just raising awareness of the virus, which is scary, but also empowering people to take actions that can limit the spread and lower the risk of getting sick. Increasing the availability of water and soap is absolutely essential. Providing materials so that people can make their own hand sanitizers, an alternative to that. Um, Emphasizing to people the power of not touching one's face. That's a method that everyone can use, and it's enormously effective. When we don't touch our face, we really lower the risk of getting sick. Providing masks to people. There's a lot of scientific debate about whether the masks protect us from getting sick, but we all agree on, what there's a consensus on, is that wearing a mask reduces the risk of sharing the virus if you are sick or if you're carrying the virus but not yet symptomatic. And then things like arranging food delivery, water collection in ways that don't require people to stand in crowded, tightly packed lines. But I want to focus for just a couple minutes on the kind of work that I'm more involved with, which focuses on psychosocial and mental health um, issues among families, and currently now families that are struggling with lockdown and partial lockdown due to the virus. We know that globally, the isolation caused by being in shelter at home or being locked in can cause a lot of anxiety for people. We see a real increase in depression, real increase in stress. Families experience increases in conflict due to a heightened stress among everyone and a lack of space. We see an increase in intimate partner violence, domestic violence, in particular women getting hurt by their partners. And we also see an increase in harsh parenting and child abuse. Now, to be clear, this is not about blaming parents. When, when families are locked into really tight spaces without any opportunities to get outside, to get away, to vent energy, stress just shoots up. When you couple that with economic stress, with worries about getting basic needs met, we see a lot of a lot of stress-related conflict and at times violence. Um, all of these patterns have been documented in the general population around the planet right now, but we can expect to see them really escalating in refugee communities where stress is already high and physical space is so limited. So to help lower stress in refugee communities and in refugee families in particular, the first thing is that it's really important that we help families get their basic needs met, including realistic strategies to stay safe from the virus. These will go a long way to lower stress. Teaching some of the things that people have immediate access to, the importance of not touching one's face, dispelling some myths. So there's a lot of fear in Lebanon, for example, when rumors circulated that particles from the virus, if someone coughed, would stay in the air for hours and people would get very panicky. So just separating myth from reality so people can stay safe, but also manage their fears realistically. And then, as I said, increasing access to other kinds of safety measures, making sure people have access to soap and water so they can wash as often as needed, and helping manage space in refugee settings so people don't have to stand in crowded lines. But also there are things families can do in the home. Stress management techniques can be shared and taught via WhatsApp and other online media. It's something we're doing at War Child. We have a number of recorded stress management activities that come from our caregiver support intervention, a program for parents and others who take care of kids. And these are simple techniques that parents can use on their own. They can use them with their children to lower stress. Some of them are fun and playful. Some are more meditative, but they're really helpful at lowering stress. And social support, helping families connect with each other through WhatsApp, through video conferencing, making sure that we limit how isolated families feel. One of the things we know is that high stress and a sense of isolation really escalates conflict and can lead to violence towards children, towards partners. And so we really need to help people minimize that sense of isolation and feel social support. This is especially true when families are really locked into closed, tight spaces like tents or small one-room homes. Just helping parents through messaging apps, through messaging, realize how easy it is to take stress out on each other or on their kids can be really helpful. People aren't always aware of what they're doing with their stress, and just helping people become more aware of that and how they're expressing it can be helpful. And especially when we couple those messages, those awareness messages, with other more constructive strategies for managing their stress constructively. And then finally, one of the things that's very helpful is to give parents things to do with their kids. Share recorded activities that parents can do with kids of different ages, from toddlers all the way up to teens. It can be very helpful, as well as sharing activities through recordings, through written messages that kids can do with each other. The more kids are playing with each other, the more they give a break to their parents, so the parents can lower their own stress and recharge their own batteries. I want to close with just echoing the message of my colleague, Dr. Felicity Brown, who reminds us not to forget the least visible and most vulnerable among us. That's not just refugee and asylum-seeking families, but all folks living in impoverished, overcrowded living conditions where staying safe is an enormous challenge. Thank you.